Good morning and thanks for joining us on Tuesday edition of TVC Breakfast. Let's bring you some news update at this time. The Nigeria Center for Disease Control, that's the NCDC, has reported 422 new cases of COVID-19, taking the country's total number of confirmed cases to 178,508. Lagos recorded the highest number of new cases with 119 new infections, followed by Rivers with 86 new cases. Ogun State recorded 85 new cases, while Oyo State recorded 20 new cases. So far, 165,982 people have been discharged, while 2,192 people have died from COVID-19 complications. Now, the surge in the number of COVID-19 cases in Nigeria is a cause for concern. The country has entered a new phase of the pandemic, especially with the cases of the Delta variant increasing in different states. Nigeria currently has 10,324 active cases, and since the start of the pandemic, 2,589,130 samples have been tested. Now, public health expert Dr. Usman Bashir joins me via Zoom from Kano to talk about this rise in cases of COVID-19. Good morning. Thank you for joining us, Dr. Bashir.
Thank you for having me. Good morning.
Now, we are seeing a surge in the number of cases, and a lot of persons are concerned. 2 weeks ago, it was reported that we had about 150% increase in the number of infections, and just yesterday we have 4 people dead as a result of this development. What do you make of this rise in cases, and what concerns do you have?
Good morning. As we all know, within the past month or so, there have been rises in the number of cases, daily cases, which might be attributed to the Delta variant, which we have been seeing coming up, which was initially was India, Turkey, and other subnationals, which in the initial part of the country was able to put some measures like travel restriction to those countries and people from those countries. But unfortunately for us, like we said, this variant is a very virulent variant, meaning it's highly infectious, it has easy transmissibility, and then coupled with our environment where we have abandoned all the safety measures, we have gone back to normal life, which we shouldn't have by now. Because if we look at the number of people vaccinated, we have vaccinated less than 1% of our population. And vaccination is one of the key areas where we can develop what we call herd immunity, whereby people will become used to it and then the disease will no longer be a problem causing death. But unfortunately for us, we have abandoned those things. We have gone back to a normal life. And even in our airports, the measures are really laxed, so people are not wearing face masks. Social distancing is not being observed, and we go back to having our congregations, large gatherings, political gatherings, religious gatherings, ceremonies, weddings in an enclosed space. So these are really the drivers, and then the feeling of low risk perception, whereby we feel I will not have it, even if I have it, nothing will happen to me, or people don't even believe in disease. So I think there's really a need for us to strengthen our borders. Our point of entry need to be really strengthened. Our surveillance system need to be up and doing, and then also our vaccination drive, meaning that people should come out and be vaccinated, because there is really a serious vaccine hesitancy, which I think it's not going to be good for us, because from what we have seen in India, this is what we are replicating in Nigeria. And my fear is we really need to work hard. We really need to strengthen our system, and then infection control.
When you say we really need to work hard, how do you mean? Is it on the path of the government showing the needed leadership to addressing this? Because a lot of persons have accused the government of not leading from the front.
Yes, the government needs to do more in form of legislation, and then, but the bulk of the stuff work on us, because it's more of personal responsibility. I need to wear my face mask when I'm going out. I need to avoid large gatherings. I need to go out only when it is very necessary. I need to make sure that I protect the other person. I need to protect myself. I need to get vaccinated. So all those things are more of personal event. Government needs to provide those services. Government needs to make sure that all those that don't wear face masks are punished. Government needs to make sure that people that are vaccinated, people get vaccinated, and that is being done. The government is providing the vaccine, but people are not coming to access it. So it's really stop on me and you. Government can only complement what we are doing, because if we don't comply, those things will not happen. And then government need to put stringent measures, especially in our borders. They need to do a lot in our point of entries and in our what they call it, in our offices.
About 4 million doses of the Moderna vaccine in the country. Perhaps how do we get to ensure that people, this vaccine hesitancy, we address it such that we ensure that we have the herd immunity that we are seeking?
I think we need to do a lot of what they call it, risk communications. We need to improve. We need to inform people the dangers of not having the vaccine and the need for them to get vaccinated and to protect us. Because only way we can achieve this, like you mentioned, herd immunity, is by vaccinating our population. And now we are almost 200 million, and less than 1% of us is vaccinated. And even the 4 million doses that we are getting now, it's only going to serve if everybody agrees, if all the people save for wastages, meaning that another 2 million will get vaccinated in the next 2 or 3 months if people come out to really take this vaccine. Because we need to really come out and take the vaccine. Because so many of us, in the initial vaccination, it was also about 4 million, but only 1.4 million of us are fully vaccinated. The remaining have not been fully vaccinated, because either they didn't come back for the second dose. And that's very key, because people who come and take the first dose, and then they will either not come back for the second dose, or they want to come back at their own time. So we need to really comply. Even if we've taken the first dose, we need to make sure that we've come back for our second dose when due. And then those misinformation that are being circulated in social media, there's really need for us to get information from the authorities, not anybody that will sit down, open his phone, and say things that are his own, that are not true, that are fake news, and then people will come to us and be asking us those things. So it's we really need to get the right information from the right quarters. It's very important.
Right. Dr. Usman Bashir, public health expert, thank you so much for your time on the program.
Thank you for having me.